understanding plantar fasciitis. What is it? Why does it hurt? And what can you do about it? Hi, my name is Luke and I'm a podiatrist at the Health Suite. What is plantar fasciitis? Plantar fasciitis is one of the most common causes of heel pain, affecting thousands of people every year, particularly those who spend a lot of time on their feet. Despite how widespread it is, it's also one of the most misunderstood foot conditions. The term itself refers to inflammation of the plantar fascia, which is a thick band of connective tissue that runs along the bottom of your foot, from your heel bone to the base of your toes. The tissues play a crucial part in supporting your arch and absorbing the forces that travel through your foot when you walk, run, or stand. When this structure becomes overloaded, tiny micro tears can develop. Over time, this leads to pain, inflammation, and stiffness, especially first thing in the morning or after periods of rest. What does it feel like? People with plantar fasciitis often describe a sharp, stabbing pain in the heel of the arch of the foot. Pain is worse when the first steps in the morning, discomfort after long periods of standing, walking, or driving. Pain that eases slightly when moving but returns later in the day. Tenderness when pressing on the inside of the heel. This condition typically starts gradually, but with proper treatment, it can become persistent and frustrating, often affecting quality of life and day-to-day mobility. Who gets plantar fasciitis? Well, it can affect anyone, but certain factors increase the risk, including prolonged standing or walking, especially on hard surfaces, running, particularly with poor technique or unsupported footwear, having flat feet or high arches, wearing shoes with little to no arch support, having tight calf muscles or Achilles tendons, being overweight, which increases load on the foot, a sudden increase in activity without proper conditioning. So why do some people get morning pain? This is one of the most defining features of plantar fasciitis. While you sleep, your foot naturally points downwards, which shortens and tightens the plantar fascia. When you take your first steps in the morning, it suddenly stretches again, pulling on these micro tears and triggering that familiar, sharp pain. So what can be done about it? The good news is that plantar fasciitis is treatable, and most people improve significantly with the right care. At the Health Suite, we start with a detailed assessment, looking at your movement, strength, foot mechanics, footwear, and lifestyle. Once we identify the contributing factors, we create a personalised treatment plan. This might include stretching and strengthening, exercise of the foot, calf, and ankle, footwear recommendations or guidance to support shoes, custom orthotics to offload pressure and support the arch, manual therapy to release tight structures and improve mobility, activity modifications to avoid flare-ups and staying active, advice on managing pain and inflammation at home. In more stubborn cases, we may recommend additional therapies or collaborate with other specialisms within our team. What happens if you ignore it? Plantar fasciitis doesn't go away on its own, especially if the underlying cause isn't addressed. Left untreated, it can become chronic, affecting your gait, leading to compensatory issues in the ankles, knees, hips, or lower back.